So I saw this French guy and he gave me an herbal formula at first visit that was 900 years old, used for my symptoms. And the next 30 days, I had the most normal GI and bowel function of my entire life. That one general formula got me better results than my Duke and Ivy League trained GI specialist. How is it possible that he didn't know about this? He would never recommend this. He probably thought it was pseudoscience. He probably thought there was no evidence behind it. None of those things were true besides the fact that he didn't know about it. So my mind was open to the possibility that there are other ways to treat illnesses, both acute and chronic, that unless somebody shares the word, no one will know about that.
Welcome to the Spa Doctor podcast, where we uncover the secrets about women's health and hormones.
I'm your host, Dr. Trevor Cates, naturopathic doctor, best-selling author, and founder of the Spa Doctor. Every episode, we reveal the best-kept secrets for achieving glowing skin, natural beauty, a healthy body, and a balanced mind. Are you ready to live your healthiest life? Keep on listening. Welcome to the Spa Doctor podcast. I'm Dr. Trevor Cates. Today, we delve into the fascinating world of traditional Chinese medicine with Dr. Alex Heyne, an esteemed colleague specializing in Chinese formulas for internal medicine. Dr. Heyne's journey into traditional Chinese medicine began during his own challenging health crisis. Alex, welcome to the podcast. It's great to have you on.
Yeah, thanks for having me.
All right, so we're talking about traditional Chinese medicine today. So before we really dive into solutions and the nitty-gritty of what we want to cover today, can you just give us an overview? What is traditional Chinese medicine? How is it different than conventional medicine, even naturopathic medicine?
Sure. So I think, my first impression of traditional Chinese medicine is seeing like a movie like Crouching Tiger, Hidden Dragon, and you see somebody do some mysterious dim mak points where they do 5 points on the person's body and their heart explodes 10 days later. And it was some secret acupressure technique, right? My impression of Chinese medicine was just what I'd seen in Kung Fu movies. And I had no idea that this was like a real clinical medicine that had long, long history and very, very clinical origins as well. So I think one differentiating factor that is the most obvious is this acupuncture theory, right? These acupuncture points, these meridians or channels as they're called, that's wholly unique, right? There's almost nothing like that around the world, right? There's nothing like that in conventional medicine. Maybe the fascia could be a close comparison sometimes, not necessarily in other East Asian forms of medicine. And even like we talked about, even in naturopathic medicine and other kinds of natural-based medicines, this is pretty unique, right? The only profession I've seen with these points, hundreds of points, maybe even thousands that are not on the channels, these very unique herbal formulas that can treat very specific conditions, but it all comes around this traditional Chinese medical theory. So I think the big thing is the acupuncture points, the meridians, and the channels are probably the most distinct feature of traditional Chinese medicine as opposed to naturopathic medicine or functional medicine or something else out there. And really what the implication of those points is. What are these points supposed to do? Where do these points come from? How do they even figure these things out, right? And how could it be that a point on your hand could treat a headache? Or a point on your foot could treat a gallbladder attack, right? What is it? And what is the relationship between the organs and how the outer mirrors the inner? So I think probably at this highest level, the acupuncture points and the channels and the meridians and this concept of qi, depending on how you want to translate that, is probably the single biggest differentiator, because that does differentiate. If you go to a naturopathic doctor or you go to a doctor of traditional Chinese medicine, they both may see acid reflux, right? But the way they treat that may be completely different. And that's informed by the medical philosophy.
Amazing. And it's a complicated system. So how do you in your practice find this balance between that and naturopathic medicine as a whole other type of medicine? So how do you integrate the two?
So I think for me, my primary practice is really the internal medicine side. So we custom compound these formulas. And it really goes into how do you diagnose and how do you treat, right? You look at like conventional medicine, it has moved away a lot from physical exams in the recent decades and centuries and heavily relies on imaging and labs, that kind of thing. And those can be very helpful. But at the same time, you and I both know from clinical practice, there's a high percentage of patients where imaging looks fine, labs look fine, but they're not fine. So is the illness real or imagined, right? And a lot of traditional doctors will say, oh, it's just imagined, it's in your head. But you and I both know it often is not, right? They're missing things that are more functional in nature sometimes or more subtle. So a lot of what we use to diagnose in traditional Chinese medicine is we use tongue diagnosis, pulse diagnosis, and I use a lot of abdominal diagnosis. So lots of chronic internal medicine conditions will show up, for example, in the abdomen. And it's surprising how few GIs even touch an abdomen when someone comes in with a digestive problem. But the abdomen is a very diagnostic method in the history of traditional Chinese medicine, going back several thousand years. Ancient doctors in ancient internal medicine books wrote, oh, if you feel this hard point at the highest part of the epigastrium, it's indicative of these kind of symptoms and these illnesses, and these formulas are what you should use to resolve this. So just yesterday, I used a herbal formula from a book 1800 years ago that had resolved 3 years of acid reflux and gastritis when they'd been on PPIs and all kinds of upper GI medications. And I just thought, how crazy is this? The upper abdomen is showing the same signs and symptoms as it did 2,000 years ago. That was already such a consistent pathology that this one doctor wrote one book about this 6 herbal formulas. So these kinds of physical exams are still really relevant in my profession to this day. And so for me, the pulse, tongue, and abdomen, including even what we call constitutional signs and symptoms, certain body types are more inclined towards certain symptoms. I do that in families, right? Some, for example, my mom is anxious, I'm a little anxious. My mom has GI problems, I tend towards GI problems, right? So those constitutional features, the body type, do they run cold, do they run warm, will also give us little genetic clues for what are the tendencies of illness.
Amazing. And I want to emphasize how old this system of medicine is. You were talking about these numbers of years, and it does say something when something lasts like this and people are still using Chinese medicine. How long has traditional Chinese medicine been around?
And it's been documented way into the BC era. We have written medical textbooks from the BC era. And that's crazy. If you can imagine, there's already sophisticated herbal formulas, hundreds. It says, remove this, add that in the case of heart palpitations. Sophisticated herbal theory around a few hundred years after Christ. So it's got to go back probably 10,000 plus years, at least before that, in my opinion.
Amazing. It's truly amazing. Remarkable that that system of medicine is still here today.
Yeah.
Okay. So can you tell us a bit about how you got into this?
Yeah. So I think, like a lot of people in our profession in particular, I always had a natural inclination towards medicine when I was a kid. I would like to read medical books. I'd read anatomy books, but I felt a tug towards studying like traditional healers, like the Native Americans. So I always had an interest in more integrative medicine to start with, but it wasn't until, and I thought I was going to go into like an integrative medicine program. And in my early 20s, I started to get really sick with a lot of GI problems. And just a lot of the traditional stories of the wounded healer, that was my start of that journey, that descent into hell, as Jung says. And I started having lots of unusual GI problems. And I had always eaten a healthy diet, was raised in a family that ate healthy, didn't have an excessive amount of stress. I just didn't understand. And I grew up in New York and Connecticut, so you have all the Ivy League schools within a couple hours. So we saw a lot of the best GI specialists, dozens of GIs, dietitian, nutritionist, all kinds of people. And they were all nice people, but no one could actually help or even diagnose what was going on. They would say things like, I think you have IBS, or say things like, you should just take this SSRI for your gut because we've seen it help. All these things. And I'm 21 and they want me to get a colonoscopy and endoscopy. And a piece of me just on a gut level felt like something was being missed. And I'm glad I did trust that, my gut instincts. And so I stopped seeing any conventional practitioner then. And I said, I still have these issues, right? I still have all these problems and I have to fix them. So I'm not going to give up. And one day I was actually in a cafe and I was just trying to regroup, defeated, not feeling well. Let me just regroup and just write down some thoughts about what I can do going forward. And by pure coincidence or synchronicity, I was talking to the barista that day and he said, I was like, yeah, I've been having some GI problems. And he was saying, oh, I have severe GI problems. And I actually developed a rare reaction to a medication and I developed autoimmune hepatitis. And he said, I saw this acupuncturist nearby, and while he didn't cure the problem, he got me better clinical results than any doctor or specialist I had seen. And he said, I don't know if it can help you, but maybe go see him. So I saw this French guy, not even a 5-minute walk away, and he gave me an herbal formula, that first visit, that was 900 years old, used for my symptoms. And the next 30 days, I had the most normal GI and bowel function of my entire life. And while in 30 days, it didn't cure a multi-year illness, I was just blown away at how simple it was with this other clinical lens, right? This guy wasn't an herbal specialist. He didn't custom compound like I do for every patient, but that one general formula got me better results than my Duke and Ivy League trained GI specialist. And I just thought, if this GI even just gave me that supplement and set me on my way, he would have gotten me better results and helped me more than what he did. How is it possible that he didn't know about this? He would never recommend this. He probably thought it was pseudoscience. He probably thought there was no evidence behind it. None of those things were true besides the fact that he didn't know about it. So my mind was open to the possibility that there are other ways to treat illnesses, both acute and chronic, that unless somebody shares the word, no one will know about that. And it just blew my mind. And besides being angry, I was happy to have at least a solution temporarily that would help me. So this just opened my mind to the fact that this is a real medicine and it actually clinically works. And it's not just in Crouching Tiger, Hidden Dragon. There's real clinical evidence behind it. And while it was new to the US 20 years ago, the evidence built every year for that it does work and how it does work and who it can help. And my mind was blown.
Wow. Amazing. I love these personal stories. And you're right. You were talking about this earlier on too, that it's not just about the labs. And a lot of times labs can be normal. A physical exam can be normal, but people can have these unusual symptoms that traditional Chinese medicine is really good at helping with those kinds of things because it's a different system. And I have over the years, I don't do traditional Chinese medicine, but as in my practice, but I have found so many patients have benefited from it. And I've referred to a lot of different Chinese medicine specialists. So it's really fantastic to hear your story. So can you explain a little bit though? You mentioned Chinese herbs, and I know some people go see acupuncturists. So why is that some practitioners will do acupuncture, but not Chinese herbs?
Yeah, the short answer is because it's hard. That's the short answer. It takes a lot of secondary skill and training to know how to do it. They can have interactions, right? They can have side effects. And it's really a very time-consuming practice unless you love it. Usually when you look at the history of doctors in this profession, the famous ones are either an acupuncturist or an internal medicine specialist. It's rare you see both. So I do both with every patient I see in person, but I am more on the internal medicine side because those formulas are what help me the most. In ancient times, there are 4 big buckets of practices a person would typically do if they were truly someone who is a master of their craft. Acupuncture, which, I'm extremely generalizing here, so somebody's going to get offended, but the generalization is acupuncture generally more for orthopedic issues, right? But it has an amazing effect on the nervous system, an amazing effect on your digestive system, but to generalize, more for orthopedic issues. And the herbal formula is more for internal medicine. So for example, I don't know anyone who would treat cancer integratively and say to only do acupuncture, right? Usually the people who know how to truly turn the tide with cancer are doing high doses of internal medicine formulas. But the short answer is a really high level practitioner would know acupuncture and when to use it, the internal medicine and when to use it, moxibustion, and even physical kinds of what would be like PT, like ancient PT practices and when to use it, right? Whether it's post-stroke. So the high-level doctor would use all of them, all of the tools within this profession, right? And so sometimes acupuncture is more indicated and sometimes the formulas are more indicated. Like with really complex illnesses, with hypothyroidism and autoimmune disease and cancer, you need the internal medicine to get people to really substantially change the course of the illness. In a perfect world, all the above, but usually it's just it's the sheer difficulty and the amount of time required to be good at both.
Yeah. So thank you for explaining that. So with your practice, can you give me an example of why somebody would come in to see you and what it would be like, what an appointment would be like?
Yeah, so why don't I give you a case study because some people will see themselves in it. So I had a young girl, I think 25 or 26, come in last year, and she's actually in the medical field herself, and she had a bad pap smear, right? 2/3 of her cervix was precancerous cells, very high on that. I can't remember the rating system, what it's called anymore, but she had a very worrying pap smear and she never had any significant gynecological symptoms. And her specialist had recommended the LEAP procedure, pretty barbaric for the listener. It's this electrical surgical procedure where they basically shave off that top layer of cells to prevent cancer. And the specialist said, this is going to have an effect on your fertility likely, and we statistically will probably have to do it again. probably at least one more time. So she went home crying. She was terrified. She was only 26. She's like, I'm not even thinking about having a family yet, right? I just need to finish my medical program. And when she saw me, she had reached out as a last resort. And a lot of the combination in terms of how we diagnose, like we talked about the 4 diagnostic methods, right? There's the looking, the listening, the questioning. You look at the complexion, the physical, constitutional makeup, the pulse, the abdomen. And a lot of women with gynecological findings will show positive findings in the lower abdomen, so around the belly button, and in a little U or bow tie shaped in the lower abdomen there. And a lot of what these findings indicate is something either gynecological or issues with the bladder, for example, or even the kidneys from our point of view. So for her, I said, it's not something I can guarantee, but it's something I've seen before. Let me treat you with an internal medicine formula for 6 months. And then worst case scenario, you need to do this surgical procedure, right? Worst case. Best case scenario, they can delay it or postpone it. So after about 4 months of taking this formula, and this formula is a formula that we use traditionally for treating conditions that involve dysmenorrhea, painful menses, irregular menses, infertility, endometriosis, I often use it for. Sometimes women after birth control, for a long period of time, their cycle doesn't return, and you utilize these formulas that improve circulation and hormone regulation. It's used often for conditions that we call blood stagnation. And this is it sounds like a scary diagnosis, but lots of conditions that involve severe menstrual pain are diagnosed as blood stagnation in traditional Chinese medicine. So she took this formula for 4 months, and I advised her to take it for 6, but she moved and she wanted to change specialists. So she had this updated exam sooner than indicated, and the next exam came back 100% clear. No sign of any of that cellular activity. And the specialist said after 30 years, he's never seen that in his entire life. And he's never seen that happen on its own in that short of a period of time. And this formula this wasn't like my Hail Mary, right? This was something I knew from my traditional mentor that it could treat that. And we have her on camera saying that she's crying and she's saying, if I could spare one woman from this barbaric procedure by just sharing my story, it would be worth it. So that formula came from one book around the year of 200 or 230. And if you can imagine, there are hundreds of millions of dollars in R&D into dysmenorrhea and HPV and the LEAP procedure and all kinds of just studying the changes in the cell types that may be precancerous in nature. And this formula was relatively inexpensive, taken for 4 to 6 months, and prevented her from having a life-altering surgery. So that's the clinical power of this, and unbelievable.
Yeah, that's truly amazing. And of course, she didn't have the procedure that
Right.
they had recommended. She didn't need to have it. She goes back in and it's gone. Okay,
Right.
amazing. And thank you for sharing that case study. I think that's truly remarkable. And I know over the years of seeing patients and referring to traditional Chinese medicine practitioners, what I've seen is acupuncture has been really helpful for pain, like somebody's in pain, especially
Yep.
like acute pain. I know for myself, like headaches or something like that, acupuncture
Sure.
would take care of my headaches. And then for Chinese herbs, I found so many women, like what you're talking about, with dysmenorrhea, painful periods, heavy periods, fertility issues. There are a lot of things that I've seen Chinese herbs are in some ways superior than anything else that I know with some of these conditions,
Yeah.
especially around period problems.
Women's health, it's an unbelievable specialty. I think at one point, I don't know what year this was, but at one point in Japan, there was something like 80 or 90% of gynecologists prescribed Chinese formulas in Japan. And they were covered by the insurance, right? And that was, again, there was no conflict of interest. I don't know the healthcare system there now. I don't know how it works, but pretty compelling based on the evidence.
Yeah. Okay. So how do you tie in hormonal imbalances? So if we talk about hormones and traditional Chinese medicine, is there any way to have that conversation together? What would you say about that?
Yeah. Look, are we talking like reproductive sex hormones or like stress hormones or both?
Any of it?
Yeah. Well, look, that same herbal text I told you about from the year 200, whatever, there's one chapter, which is hilarious. It's called Running Piglet. And the running piglet was an ancient term for panic attack. right? So they say that it's funny when you think about it. If you've ever had a panic attack, people are like, yeah, I get it. I've had a panic attack before. I had to run outside to discharge this uncomfortable sensation. And the doctor says the patient feels as if there's chi surging up into the chest and the throat and they're about to die. And then it goes away and it comes back cyclically again. In ancient times, of course, they had panic attacks, right? Of course, they had dysmenorrhea. Of course, they had infertility. Ancient people observed the effects of hormones, and they obviously didn't know what hormones were, because I don't know when in human history this term hormone came, probably the last few hundred years in modern chemistry, right? But ancient people had observed the effects of hormones, whether it was stress hormones. They were living much closer to the edge than we have ever been now, right? But also reproductive hormones, right? There is unbelievable textbooks 500, 1,000, 1,500 years ago, specifically for women's health, for every single medical condition a woman could have, all the way up to cancer tumors. I'm not saying they could easily treat cancer tumors, but they had observed, right? One doctor, Sun Sum Yao, had observed that sometimes there are these, he's called like the medicine god of China, lived to be over 100, very concerned with like social welfare, helping women, helping children, helping the poor. And a lot of his work is on like women's health. And there's so many individual chapters on various women's health conditions, whether it's irregular menses, painful menses, pain with intercourse, infertility, recurring miscarriages. So these problems, I think, have been around for thousands of years. And so while ancient people didn't know hormones were the cause, maybe they had invented thoughts in terms of the etiology, the pathology, but they had developed effective formulas that still work to this day. So I think both in terms of stress hormones and, let's say, reproductive hormones, those formulas, amazingly, those two things, treating like HPA axis dysregulation, stress, anxiety, panic attacks, heart palpitations, as well as women's health, are probably two of the single most effective subspecialties of these formulas.
Incredible. We just didn't know the body in the same way back then, and it's a different system of medicines, but we can still talk the same language these days. So when you talk about Chinese herbs, there's also just regular herbs, Western herbs, let's call them, right? Can you explain a little bit about the difference between those, or can you give us the names of some common traditional Chinese medicine herbs that you might use for women's health?
Yeah. For example, one of the formulas that we talked about when we talked about this patient of mine that had the cervical dysplasia, one of the main herbs that's used very commonly that you don't see in Western or even maybe functional circles is we use a lot of what's called guijia and roguei, a medical grade cinnamon bark and cinnamon twig. So this herb clinically is one of the statistically most commonly used for, on the nervous system side. This herb is so effective at regulating the HPA axis as well as regulating the heart rate. More people have gotten off antidepressants, SSRIs, beta blockers, various medications for the heart using this herb than any other herb in my practice. Clinically, it's amazing for what I call like the trifecta of HPA axis dysregulation, anxiety, elevated heart rate, palpitations, and insomnia. Really common issues in our modern world, right? And this herb is very well studied for the effect it has on regulating the heart rate. For example, so many young people I've seen on beta blockers that are in their 30s that don't have any heart problems, but it's just chronic stress. And they're put on beta blockers for years. They can easily get off of these medications with this kind of herb. It's also very good on the other side for circulatory problems, right? So this cinnamon twig is very good for circulation in general. It's very good for people that run cold. Like some women come in and they're thin, they're pale, they're cold, they're very anemic looking, their hair is thinning and drying out. This really helps improve the circulation, and almost in conjunction will also help regulate the menses in that way as well. Another herb that we often use is called Baishao peony. So this is very, very good. It's an herb that we sometimes lump into the category of like a blood builder. So it's often used in formulas for women's health, whether there's painful menses is probably one of the main indications. So herbs, formulas that are high in this herb are very good for regulating painful menses. And the two are actually combined very often here. Other herbs that we end up commonly using are herbs like, I'm trying to think for more specialty. Another herb is called tauren. I think that's peach kernel or apricot kernel. I have to remember the exact one. But it's often used for what we mentioned this idea of blood stagnation, right? So this herb is used for like endometriosis pain. It can be used, I've sometimes seen fibroids be dissolved through this, smaller fibroids. That's another big issue that doesn't really have any treatment besides surgery and conventional medicine. And it's often used for pain. And it's also used for the pain of even cancer tumors. So tauren. So some of these herbs are some of the ones that are commonly used specifically more in women's health and more nervous system related issues. It's very different if we move towards GI or acid reflux, that kind of thing.
So the first one you mentioned, that's not like the cinnamon that we know of, not the,
Right.
It's a different type of cinnamon. I just want to make sure that I heard that correctly and everybody else heard that correctly.
Yes, because I know someone,
cinnamon. Yeah.
yeah, people will think, oh, the cinnamon I got from Trader Joe's and I put in my oatmeal. And it's, these are specifically from trees that are 30 or 40, 50 years old. Also, a big thing is the dosage, right? So the dosages we use in traditional Chinese medicine, way higher. When you read a study on, supplementing with 500 milligrams of ginseng will improve cognitive function, we use a standard dose of 9 grams per day, right? This is 20 times the dosage of what you're seeing people taking over the counter. And also, they're almost exclusively used in formulas. We almost never use single herbs. And this goes back thousands of years to this herb is put in this formula because it can offset the side effects of this one, right? This herb will moderate the side effects of that, or this herb will improve stomach acid levels, but protect the gut mucosa, right? So you see often high doses of dried ginger with high doses of honey fried licorice as a protector. It's very sophisticated, the herbal theory here. And exactly, we'll use a standard dosage of 9 grams of cinnamon twig or cinnamon bark, which is different from 25 milligrams sprinkled into your oatmeal in the morning.
Yeah. So you mentioned ginseng. That's an herb that people know of in like Western herbal medicine, right?
Yep.
So there is some overlap. There are some herbs in Chinese medicine that you might find in like a health food store herbal supplement. But like you said, there are many other ones. There's so many different types of Chinese herbs that I just want people to understand the big difference between the two and how this system of medicine is even just the diagnosis is different. So it's you'd have to see someone like you that's well trained in this. You wouldn't just go into a health food store and pick up a Chinese herbal blend necessarily, right?
And what's interesting, ginseng is a great example, right, of how it's used Eastern versus even like functionally, right? When you look at like the literature on ginseng, a lot of it focuses on the HPA axis, right? Used for depression, cognitive function, that kind of thing. But in Chinese medicine, we almost exclusively use it for digestive problems, interestingly. So ginseng is one of the focal herbs in a lot of upper GI issues like acid reflux, indigestion, gastritis, gallbladder issues, often very used for SIBO, right? Issues with bloating and food babies and loose stools and food allergies. It does have a function, obviously, on the HPA axis, on the mood-related disorders and that kind of thing. But when you look at clinically, the formulas, it's often used more so in the digestive zone than it is for what we use for mental emotional issues. So that's a very big difference, East versus West, in terms of how it's often used clinically.
Yeah. Okay. Great. So we talked a lot about herbs. We talked a little bit about acupuncture. Traditional Chinese medicine has a really interesting take on food as well. So can you explain a bit about how that works?
Yeah. So a big difference in this is really useful because day to day, you hear people seeing things like green tea. I saw a study on green tea that says it's healthy and it has, right, antioxidants and it has all these phytonutrients, right? So I should just drink it every day, 10 times a day. So take green tea, for example. It's a great question about dietetics because this is definitely a big difference, East and West. So green tea, you may see a study or you may see someone on social media say, green tea has all these beneficial nutrients and antioxidants for you, so just have it every day, 10 times a day, right? In traditional Chinese medicine, it's something called flavor and nature, right? The flavor and nature are sometimes translated as you have like sweet, sour, salty, bitter, and then what we call cooling and warming. So for example, let's say you have someone, let's say we go back to that, let's stereotype, we have this female person that comes in, she's thin, she's cold, irregular menses, very hypothyroid looking, anemic looking, doesn't have a good appetite, easily can miss meals without feeling hunger. Now, this person we often will say has stomach cold, interior cold. And what that means is that there's often not enough stomach acid and not enough pancreatic enzymes. So this is often the root of their poor digestion, can't gain weight, that sort of thing. But we often use stimulating warming herbs for that. So for example, a common herb combination we would use is ginseng, dried ginger, an herb called Baiju atractolodes, and honey fried licorice. And that will strongly stimulate appetite. It will help them put on some weight over the coming months. It will regulate stomach acid, pancreatic enzymes, help their digestion much more. But let's say this woman comes in and she heard in a great study she should drink green tea. So while green tea does have all these varying kinds of nutrients and chemicals in it that are beneficial, green tea is what we call bitter and cold. And bitter and cold is the worst flavor nature combination for this kind of pattern, right? This person needs basically warming foods and warming herbs, right? Sometimes people come in and they're having these ice cold smoothies and they're having celery juice because the medical medium told them to drink that. And they're like, why am I bloated all the time? And why do I have like diarrhea and loose stools? And this is a function of bitter and cold. So lots of greens are on the cold side. And this is, sometimes people call it the chi or the quote energy of it, but there's an intuitive reason why people drink watermelon and they drink like mint in the summer, right? And why normal people don't drink like iced watermelon smoothies in the New England winter. It's an intuitive sort of animal. People want to drink like a warming cup of anything or drink like chicken soup or something hearty. That's the intuitive animal body recognizing that this is something that's good for me. So you read a study, green tea is good for me, but low appetite, easily indigested, right? Can't eat big meals. And then you're throwing in bitter and cold flavors and natures into the person's stomach. I promise you're going to worsen that. And celery juice is probably the most common one that I see, right? Because I live in Los Angeles. I guess medical medium has a big influence here. It's also the smoothie capital, the raw green juice capital. It's fine if you have great digestion, or like ancient people called it like stomach fire, right? It's like the crock pot. If you have a good high flame, you can cook that steak, you can cook the big bone broth you're trying to make. But if the flame is low, it will never cook. And it's just going to sit there and ferment and sit in your stomach. That's a conceptual way to think about the stomach digestive fire, right? That enough enzymes, enough of the stomach acid. So that's a quintessential East versus West. Someone says green tea, good for me, but then they overdo it. And they're like, man, I'm getting even more indigestion. I'm even less appetite, even more bloated.
Yeah, that's amazing. And it's not just a matter of have warm green tea instead of cool green tea, right? It's
Sure.
actually just the green tea itself is more cooling, even if it's served hot,
Yeah.
right?
It's
Just an
right.
interesting
Absolutely.
thing to think about. People are just like, it's hard to wrap your head around that because the traditional Chinese medicine is it's a different approach.
Yeah.
And I don't want people to get too caught up in this and worry.
Yes.
Basically,
Agreed.
the thing is that if you're interested in this, work with someone like Alex, Dr. Heyne, that specializes in this so that if you feel like conventional medicine is not working for you and maybe you're still searching for something and some of these things are resonating, it's something to look into. But I think so often today, people just want to Google things or use AI, just find it themselves and search it. This is not one of those things because it's just going to lead people down a rabbit hole.
And it's like everything in life, the dose makes the poison, right? It's like exercise, good or bad. Food, good or bad. The number one killer of people today in the US is food. So should we just not eat food? It's what, and it's how much, and it's who, and it's what season of life, and it's highly customized in that way.
So this is about education, about understanding options, and that this is an option. So who would you say are like the perfect types of patients or people that would benefit from traditional Chinese medicine?
I would say a common archetype for me anyway would be people with internal medicine issues, right? More digestive, anxiety, depression, women's health, sleeping problems, that kind of thing. Also really like honestly complex cases, autoimmune diseases, integrative cancer care, because I've seen how that can really turn the tide in a big way. But I would say in general, if someone is really interested in, look, for the listener that just wants to take their medication to the day they die, that's okay, but they're probably not going to see someone like me, right? I would say if you're interested in seeing if the chronic health issues you're having if you want to be able to get off those medications, then I would say definitely see someone like me, because very often we can. And I think if people are also interested in healing, and that's a very specific kind of person at a specific moment of life, right? Because some people for a few years may just take the anti-anxiety medication until they're like, you know what, I have the bandwidth now I really want to fix this. And I don't want to increase the dosage, or I don't want to add on another medication. I'm ready to get rid of this. So I think a lot of what I see is the best people are when I catch them at the moment where they really want to heal and feel better, and they're not interested in taking medication for the next 20 years. I would say that the perfect kind of patient archetype is they may have been on medication and that's perfectly fine, but now they're realizing that I don't want to go down this road for 10, 20 more years. And I want to figure out why this has been happening.
Yeah. Yeah. Thank you. That's great. And you have a really large YouTube following. You've got some videos that you've shared to educate people on traditional Chinese medicine. What are some of your most popular tips on YouTube that people are like, oh my gosh, I'm so glad you shared that with me?
You know, the absolute weirdest one is a video on constant throat clearing. It's the most
Oh,
bizarre video that has taken off. And this is one of those things there's a video, it's just constant throat clearing. And we talk about whether it's food allergies or we talk about the Chinese medicine pattern differentiation. So it's often translated as spleen qi deficiency. This is anything that involves mucous membranes and mucosa. So constant upper GI issues or sinus drainage. So that's a very bizarre one that's taken off quite a lot. And there's two very simple formulas that can resolve that, no problem. And this is just like a little bothersome symptom. There's nothing in conventional medicine for. I think we've had some on my own experience using Qigong. So using this kind of like energy practices and what they can do, what they're designed to do, and what the purpose of them is. That goes back thousands of years as well.
can you explain a little bit about Qigong? Because
Yeah.
that is part of lifestyle. It's because we've talked about a lot of different things, including food, but movement is another part of traditional Chinese medicine.
When we look at like the traditional definition of Qigong, we're looking at usually the intersection of three things. We're looking at physical movements combined with specific breathing exercises and often combined with visualization of some kind. So technically even physical exercise could be Qigong depending on how you do it. But the traditional definition is these overlap of these three. And Qigong translates as basically Qi work, right? So whether you want to translate it as breath work or energy work, it goes back for thousands of years. And the reason why it's considered so valuable is that one of the ways you could define health for my profession is the free movement of Qi or the proper physiological function, right? That's a very non-mystical way to view it. If we make it as reductionistic as, okay, I'm chronically getting indigestion. Ancient books call that stomach counterflow. So the Qi is going up when it should be going down. That's pathology, right? At the baby little seed of the oak tree. And that may lead to, in a year, acid reflux. In 5 years, that may be Barrett's esophagus. In 20 years, it may be esophageal cancer. Ancient doctors and ancient practitioners were concerned with the flow of Qi in the body, the proper physiological flow of the organs, right? A very painful menses for 3 days where you're sick is very pathological, right? That's considered a little canary in the coal mine, that something is blocking that flow of the hormones and the circulation. Qigong is a non-pharmacological way to affect that flow. So you can have indigestion, and there are Qigong exercises, whether it's breathing or it's tapping on the upper GI or massaging the upper GI, that will, in 10, 15 minutes, make you feel less indigested without putting a formula in your body, without acupuncture. So in a perfect world, the highest level of medicine is no medicine, right? Is not eating any kind of medicine. And Qigong is one of those ways that is less interventional. And also, it's viewed as like a superior form of exercise because Qigong will never exhaust you. If I go do a tough circuit workout for 2 days, I'm tired. And you can do that. But if you're working 80 hours a week and you're training hard and you're a parent and you're a caretaker, you're going to get sick. And that's just dropping the battery charge. Qigong is something that someone with cancer can do as many hours a day as they can. If they can do 5 minutes, that's it. If they can do 2 hours, they can do that and they will feel more energy and they won't feel tired the next day. It's also low impact, right? You're not going to hurt your joints from doing too much running or doing too much weightlifting or too heavy weightlifting. So it's viewed as almost like the idealized form of exercise, right? Because you're breathing and you're moving and you're visualizing and you can target certain areas for longevity.
I'm glad that we talked about all of the aspects of traditional Chinese medicine. Is there anything else you want to leave our audience with? Anything that you feel like we haven't talked about that's an important part of traditional Chinese medicine?
I think in general, people just need to really trust their gut on their own healing journey, right? Whether this is just for the lay person or other practitioners, if there is something in you that says, I've taken birth control for 10 years and maybe this can be related to one of my symptoms, right? Or maybe this chronic upper GI medication I've been on, maybe it's not going to be good to be on that for 30 years. Or maybe this anti-anxiety medication, there's another way we can treat this where I'll be free of this in 6 months or a year. I think trusting that gut feeling is underrated in a world where we really overvalue objective scientific knowledge to the exclusion of everything else. The labs matter more than what the patient says or feels, right? That's only the objective matters. But the reason I found this profession was from a gut instinct, right? That gut feeling, that like calling, that vocation. And wherever those impulses come from, I don't know. But that's what led me to this most incredible part of my life. And I think for the person that's ignoring that, you're missing out on some good intuitive or instinctive data that's trying to bring you somewhere for your healing.
Thanks, Alex. Will you tell everyone where they can find out more about you, or they can reach out to you?
Yeah. So people can just go to dralexheyne.com. My last name is Heyne. We also have a little quiz we've put together because Chinese medicine is so unique in its diagnosis that if you just click the link, it'll just bring you to a little quiz, which is like a free root cause quiz. It's like a 12-page PDF I put together. It also links to our top videos on each symptom. So it's really exhaustive. It's free. And that will help people be familiarized with how does Chinese medicine view painful menses or migraines or acid reflux or SIBO. And then that same name for my YouTube channel, we put out a couple videos every single week. People can check that out. Those are pretty long form content on how does Chinese medicine view certain symptoms. And then on Instagram as well, we put out something pretty much every single day. So that's probably the best way.
Well, thank you so much for coming on. It's so great to learn all about traditional Chinese medicine. Thank you.
Yeah, thanks for having me.
Thank you for tuning in to today's exploration of traditional Chinese medicine with Dr. Alex Heyne. I hope you gained some valuable insights into the transformative power of traditional Chinese medicine for your own health journey. Subscribe for more insights and visit our website to delve deeper into today's topics. Here's to your holistic wellness. Thank you for listening to this week's episode of the Spa Doctor Podcast. See you next Sunday for a new episode on your journey to living your healthiest life at any age.